kind of go into my presentation?
Just go for it. Yeah.
Here we go. So hi, everyone. My name is Elena Rosenberg-Carlson. I'm the Ending the HIV Epidemic Coordinator here at CHIPS. And I'm really delighted to share some information with you today about our supplement project on a regional response to HIV eradication in California counties. There we are on the next slide, so that's great. You can see part of it there. So I wanted to start off really by acknowledging that collaboration and partnerships are just really foundational to this project in particular, and that the information that I'll be sharing is a reflection of contributions from all of these amazing partners and more on the slide. I want to especially call out the LA County Division of HIV and STD programs and also the State Office of AIDS for their support and really critical contributions to this project from beginning to end. And our CHIPS Community Advisory Board for consistently offering lots of fantastic insight to inform the project. And then I wanted to be sure to note that I have the privilege of presenting on behalf of our great project team this morning. Their names are all listed at the bottom of the but led by Dr. Shopta and Wen Ko, who are both in our session today. So thank you. Next slide, if that's an option. Okay. So yeah, you can see part of this here, I think, but we know that significant advances have been made in HIV treatment and biomedical prevention so that we now have extremely powerful biomedical tools available to address HIV. And we also have advanced epidemiological techniques now available to help us really pinpoint areas experiencing high levels of transmission. Yet there are 8 counties in California that remain heavily impacted by the epidemic. So up north, we have Alameda, Sacramento, and San Francisco. Down here, we have Los Angeles, Orange, Riverside, San Bernardino, and San Diego. And these 8 counties have all been identified as priority jurisdictions for phase 1 of the federal Ending the HIV Epidemic Initiative. So as you can maybe see here on the slide, several of these counties share borders. They also share commingled HIV transmission networks. And they all share some common challenges as they work to address the HIV epidemic. Yet there is very limited coordination and collaboration currently that exists across county lines to address HIV. Next slide. Oh, perfect. Thank you. We made it. So the goal of our EHE supplement project was to explore regional coordination as an implementation strategy to increase the impact of efforts to address the HIV epidemic. And to do this by bringing together stakeholders from the 8 EHE priority counties in California by assessing key needs, collaborative opportunities, and existing resources across these counties, and then by compiling our findings and recommendations to help facilitate an EHE regional response to help end the epidemic here in California. Next slide. So on January 24th, 2020, just almost exactly a year ago, we hosted an all-day regional stakeholder meeting to initiate a regional approach to the EHE response. And the purpose of this meeting was to provide the first opportunity for regional stakeholders from the 8 priority counties to come together to share current EHE strategies, challenges, and opportunities for collaboration. So we had about 150 community stakeholders, county representatives, state representatives, federal representatives, and many other HIV partners who are committed to the EHE initiative across our 8 priority counties who came to engage in the regional stakeholder meeting. The meeting included 6 distinct sessions of presentations and panel discussions, during which representatives of agencies and organizations serving the priority counties shared their efforts to address the epidemic, and they highlighted challenges that they face and suggested opportunities for regional collaboration. The meeting structure provided question and answer opportunities between sessions, as well as a networking lunch to help facilitate connections and initiate new partnerships across the region. And participants were also given the opportunity to share their ideas and feedback for the regional response before, during, and after the meeting through many different opportunities, including surveys, sticky note exercises during the meeting, and follow-up calls, and also a virtual follow-up meeting in April. Next slide. So after thoroughly analyzing and synthesizing the meeting discussion and all of the stakeholder feedback, there were 5 key areas of need that emerged as stakeholders envisioned what it would really take to have a successful regional response to the epidemic here in California. And so stakeholders frequently shared that having adequate funding to support region-wide planning and activity implementation is a critical need for the regional response. In the pre-meeting survey, the most commonly chosen facilitator of success for the regional response was funding to support and maintain regional activities. And also the most commonly chosen anticipated challenge for the regional response was a lack of funding or resources to support the regional effort. So funding definitely came up as a key area of need. For many stakeholders, the most pressing needs relate to addressing key social determinants of health impacting those living with or at high risk for HIV. So comments frequently highlighted issues with systemic discrimination and stigma, housing, intersecting substance use and mental health challenges, and access to healthcare service sites and providers. Stakeholders also commonly shared concerns that the workforce on the front lines of the EHE effort is not adequately supported. And they shared that many healthcare providers need some additional education and support on key topics related to HIV prevention and care. Stakeholders also commented on the need to increase community engagement and partnership as part of an EHE regional response. Many folks shared that response activities should be rooted in addressing community needs and that they therefore really require active engagement of priority populations. And several stakeholders stressed that the region needs to be innovative in its approach to increasing engagement of hardly reached populations, and really that the regional response won't succeed without community voices at the table. Finally, stakeholders conveyed a really strong need for infrastructures that support information sharing across county lines. Priority counties need to be able to quickly and easily communicate about best practices and relevant resources, and also need to be able to share primary HIV surveillance data elements. Next slide. We received a wide range of recommendations from regional stakeholders for initial topics to prioritize as part of the regional response. The priorities you see here on the screen were mentioned quite frequently and kind of rose to the top in our thematic analysis. So infrastructures to support regional information sharing and collaboration, PrEP education, rapid ART and linkage to care, emergency department HIV testing, substance use and mental health issues contributing to the HIV epidemic, and service provider education and workforce development really rose to the top. And then if you could just click forward one. Okay, so I'm not sure, that might be a little bit hard to see. There are some tiny words there, but I just wanted to share that in addition to these priority topics, several activities were identified as possible kind of opportunities to move these topics forward. So several different infrastructures, including a learning collaborative, steering committee and working group infrastructure, and also possible infrastructures for data sharing, you can see at the top. And again, in the interest of time, I'll move forward, but I just wanted to share that in addition to the priorities, there were some key activities here that, that were recommended to help move the response forward. Next slide. Okay, so since our funding period ended in August of 2020, the end of August, we have been really working to help facilitate action on the identified regional response priorities. And a key activity that emerged from the project was the creation of an EHE regional learning collaborative, which has monthly sessions to help facilitate knowledge sharing and to really build readiness for coordinated action on the EHE goals across our California priority counties. And also additional planning discussions and regional meetings have been initiated to help sustain coordinated efforts to address the EHE goals. And that includes our first kind of regional meeting since last January, which focused on taking strategic action to address substance use in California. That occurred in late October, and we're looking forward to some more kind of action on items that came out of that discussion coming up early this year. Next slide. Well, thank you so much for the opportunity to share our regional response project with you. If you're interested in learning more or getting involved, we welcome anyone and everyone. And we do have a dedicated webpage with our reports from the project, materials from past events, and information about upcoming events. So that's listed here. And also, please feel free to reach out to me if you have any questions after the session. So thank you.
Thank you so much, Elena. That was really great, and it's been really exciting to see this effort roll out. Do you, I don't see any questions immediately in the chat box. Please, as a reminder to the audience, please include any questions you may have for Elena. I'm just going to kick it off with a question about what are some future plans for additional events or activities for the region using this, this structure that you're building?
Yeah, thanks so much for that question, Wendy. Well, we have a couple of exciting activities that are coming up that are already kind of in the planning process. So one is our next learning collaborative session, which will be on February 16th. And that's going to be on mobile service delivery. So we know that several of our EHE priority counties, I think at least 4, did include mobile service delivery in their EHE plans. So that hopefully is going to kind of help, again, facilitate knowledge sharing across the counties around this, this exciting intervention. We also, specifically in LA County, we've been partnering with the Wallace Memorias Project on an upcoming meth-related symposium, and that was kind of kicked off after our October Taking Strategic Action to Address Substance Use in California meeting. So the meth symposium is set for the afternoon of March 9th. Folks will get more information about that in the coming weeks, but that's going to be an exciting opportunity to kind of, again, extend those substance use discussions, and we're hoping that that can be a launching point for more regional action on that topic as well.
Sounds great. That's really exciting. And I hope that that folks are able to join that. I'm looking forward to participating in those also.